So we've got a great panel that's been assembled earlier today to be able to talk about, again, healthcare and COVID and some of the things that we might anticipate as we go into the fall and go into next year. And so kind of our program for today is I'm going to introduce our moderator as well as our panelists. And then from there, I'm going to turn things over to David Anderson, who will facilitate a discussion amongst our group. A few things, if you have any questions, I'm going to ask if you would use the chat feature to post your questions. And then certainly we will take those questions as they come. The other thing is certainly I think everyone has been muted here. And so with that, I'm going to quickly move into introductions of our speakers and participants. So first is our moderator, who is David Anderson. And for those of you that have been a part of the chamber for a few years, you know David is our immediate past chair and is the CEO of Anderson TrueNorth Group. But David has a great healthcare background, having served as president in hospital supply distribution for Cardinal Health. He was also their senior vice president of and general manager of innovation and strategy. He has also worked for, been on the board of the Health Industry Distributors Association, and has held a number of other senior level executive positions all around healthcare or, again, affiliated with the healthcare industry. And so, again, we've got, in David's expertise, I think will do a great job with us today. Moving into our panelists, we have first Dr. Veronica Deza, and she is the physician site lead for the Columbia Gateway office of Kaiser Permanente, where she's been for the last 3 years. And she's also a provider in the memory care program that Kaiser started last year. She also has taught family medicine for 15 years before coming to Kaiser in 2015. She's a native of Argentina, and she's graduated from the University of Maryland School of Medicine, completed her family medicine residency at MedStar Franklin Square, and was the chief resident. Next is Dr. Arvinder Uppal, who is a radiologist. And she is the president and CEO of Charter Radiology. And as she affectionately goes by Daisy, she has many roles at Charter Radiology, which includes founder and chief executive officer, radiologist, patient advocate, and team builder. She has a passion for radiology with her love for taking care of people, and she has built Charter Radiology into one of the region's most advanced radiology practices. She received her medical degree from Albany Medical College and completed a radiology fellowship at the Johns Hopkins Hospital. During her medical training, she was a recipient of 2 prestigious research awards and has authored numerous articles and presentations on advancements in radiology. And she previously served as radiology chairperson at Howard County General Hospital, as well as the Outpatient Center Medical Director for American Radiology Services. And lastly, but certainly not least, is Steve Snelgrove. And as president of Howard County General Hospital, Steve Snelgrove works to ensure patient safety and satisfaction and to create an excellent system of care for county residents through good relationships with hospital employees, community providers, and outside organizations. Since 2014, when Steve arrived, the 245-bed hospital has earned several healthcare awards, including a designation from Blue Cross Blue Shield Association for excellence in maternity care and in knee and hip replacement. Additionally, the hospital continues to receive top honors from the American Heart Association, American Stroke Association for its primary stroke program. And so that's just a tidbit about our speakers today. And with that, I'm going to turn things over to you, David.
Thank you, Leonardo, and hello, everyone. Glad to see everybody is looking well, and I'll just say, good afternoon and welcome once again. We really do appreciate your participation as audience members, as well as in particular to our 3 distinguished panel members. I think it would be an understatement for me to say the times we're experiencing are extraordinary related to COVID-19, and related circumstances. And even despite that, we're pleased to be able to get a great group together to have this discussion, to share insights, and we're hopeful it will be valuable for all participants. So we will have this discussion until about 1:25, so slightly less than the next hour. We have some prepared questions for our panelists. However, we'll also do our best to incorporate questions from the audience that's participating. And so if you do have any, please do send those through the chat function, and we'll do our best to address some or as many of them as we possibly can. So Leonardo has already introduced Dr. Uppal, Dr. Deza, and Steve Snelgrove. So I'll add my welcome and thanks to Leonardo's comments to all three of you. Thank you for agreeing to participate. Thank you for sharing your perspective with us today. So in the prepared questions, we have some that are, much more kind of informational, and we're hopeful they will be good on a forward-looking and helpful on a forward-looking basis. But before we get into those, and I'll address this question to all three of the panelists, perhaps starting with Dr. Deza. I think it's a question that's important within our community, within our families, within our businesses today. And the question is, how are you and your people with your respective organizations doing right now? Dr. Deza, would you be okay to be the first to offer your thoughts there?
Okay. So I think fortunately everybody is doing well. I think when we first reopened to start seeing patients again sometime in June in the outpatient setting, many of us were maybe a little scared to go back in and wondering, is our PPE going to keep us safe? But fortunately, everything works well. We have all been safe with the face mask, the shields, we don't see any COVID patients in our primary care center, so we're not having to wear the N95 respirators. We have them there should somebody, come in who, may be a person under investigation. But in general, we've been doing well. What we're now trying to do, since we're seeing patients at about 50% capacity in the office, the demand for more in-office appointments is increasing. So now we're trying to figure out how to make that happen while at the same time still maintaining the social distancing and all the safety features that we already have in place. So I think that's what we're working on now. But for the most part, everybody fortunately is doing well.
Great. Thank you, Dr. Deza. Glad you are. And, I think of how strange things feel as a non-healthcare provider. I can only imagine for you and Dr. Uppal, who are right on the front lines, as well as Steve, how interesting days must be, particularly those over the past few months. Dr. Uppal, I'd ask the same question of you. How are you doing? And as the owner-operator of a small business, how are your people doing? Dr. Uppal, we're not getting audio for you. Perhaps you might be on mute.
Can you hear me now?
Oh, can hear you now. Great, thank you.
Okay, so I said, yes, I do wear a dual hat. I'm a physician first and a business owner. That I still don't think of myself as a business owner, but yes, I still have to operate a business. So, it was very easy when this thing happened. It's like, I immediately put my physician hat on and started thinking that not only I'm a medical director, so I am the chief in charge, so I need to set my protocols. So like we said, we all went to N95s and we all wore the shields in the very beginning because COVID was not known, and also we were starting to see COVID patients. We instituted a scrub policy that we would all come in, we would change our clothes and we would wear scrubs. And then at the end of the day, discard the scrubs so that the viral load stays in-house. So we all instituted that very strongly. We had the Cavicide and the wipes, so we were cleaning. Very strong policies were instituted. So as the volumes went down, the attitude of the team really is the most amazing thing I have to say, is that how everybody came together, and everybody worked together as a team. So that attitude is what kept us going through this whole pandemic. Um, Fortunately, none of us became COVID positive or had any symptoms, even though we treated patients. Then we, of course, instituted the glass shields that you now see in front of Charter's front desk. But obviously that took time to come about because they were not readily available as the pandemic hit right away. So I think we got them 3 weeks into the pandemic that we were able to institute. And my staff feels a lot safer once those glass shields went up.
That's great. Thank
Mhm.
you, Dr. Uppal. I do appreciate it. You know, I think about it from a personal vantage point, and I'm still a little uneasy just going out to get my Amazon packages outside of my house. So, Dr. Deza, Dr. Uppal, and Steve, as I'm coming over to you, I can't imagine what Howard County Hospital has had to go through in terms of the adjustments. And so, if you would please share your thoughts. How are you doing? How's your team at the hospital doing?
Doing well, and I think our team is doing well. I got to be honest with you, it's been a really tough, 6-7 months to recognize the loss really of all of our elective surgery and people who really critically ill needed surgery but could not have it. Well, we devoted our capacity to preparing ourselves for the influx, for the surge of COVID patients that we received. And the team has been incredible, but the daily changes in the science, the daily changes in the expectations from CDC and the politics literally going on across America, creates the biggest challenge of all, and that's effective communication. So we started every single day from really day one to ensure that all of our leaders had a face-to-face conversation with the staff. We're able to look them in the eyes and really explain what was going on that day, how we were managing PPE, the changes in that, the changes in the science of how you manage the patients, how you stay safe yourself, things that are out now common knowledge were not common knowledge at the very beginning. And we really had to work hard to ensure effective communication and really alignment, accountability to do the right things for our employees' sake, as well as the patients and families that we served. And it was difficult. We had to stop allowing visitors to come in without, except for some very rare exceptions. That changes how we practice medicine. We had to, our facilities were impacted in terms of our ability to have enough ICU, med-surg and med-surg beds that met the special air handling requirements that are necessary to manage these COVID patients effectively. Obviously, the day-to-day challenges with PPE, we don't do this alone. We do this as a member of Johns Hopkins Health System, and we were fortunately able to take care of our system needs very effectively, as well as our patients. When this first started, we had to obviously be available 24/7 to take the influx. We initially, as a system, decided to move some of the more complex COVID patients to Johns Hopkins Hospital with the capacity to manage them. About a week later, we were all managing the same patients across the system. And I think it's truly a demonstration to the innovativeness of our leadership, both locally and at the system level, as well as the resiliency of our care providers to stay with us. They are impacted both personally and professionally. We know the impact on work-life balance, but the attitude of our people have been amazing, and the support from the community has been so overwhelming as well. These are the first responders, or there's others in the community as well, but these people never fail to show up when called to respond to this challenge, and I'm so proud of the entire team and the support that we've had in partnership with the health department here to serve this community. While things have quieted down a little bit over the last few months, we still have run about 15 to 20 COVID patients in the hospital every single day. We serve the system for behavioral health patients with COVID. And we intake all of those patients, which is a special challenge, and our ability to invest in understanding this need and how to manage those patients has been pretty effective. But we're also preparing for what's coming in the future. There are all kinds of predictions about a second surge as the weather gets cold, and we're working on that right now. But I do want to leave you with the final recognition of all of the support that we've had from the community. It's been tremendous from the county executive on down, and we're so appreciative of all of that.
Great. Thank you, Steve, and we appreciate you and all that you and your team are doing, as well as Dr. Uppal and Dr. Deza. I'll go into the first more kind of tactical question here. So all industries have changed for us temporarily as a result of COVID-19 and the pandemic. We socialize differently, we shop differently, we educate differently, we do healthcare checkups, and we go to church differently than we ever have in the past. Some industries and facets within them will actually change with permanence, right? There will be some permanent changes that will occur. And so I'll ask questions from a couple different vantage points. And if you'd allow me, for the panelists, I'll direct pieces to this to each one of you. The first, and for all of them, the primary question is, so what are the more permanent changes from your vantage point in your corner of the healthcare environment do you anticipate will be permanent? And so this first one I'll address to Dr. Deza. From the vantage point of a care provider, what most significant changes do you envision?
So before the pandemic started, Kaiser Permanente had a fairly robust video visit program to begin with. And then obviously after the pandemic, when everything went virtual, you know, all of our care was virtual for a few months, and then we reintroduced office-based practice again. So now the way we're working it to maintain social distancing is in each of the offices, maybe 2 or 3 doctors are in there at any one time. The rest of the doctors that would normally be in the office are home doing virtual care. So right now, in general, 50% of all visits are in office, 25% are virtual, and 25% are phone appointments. The great thing, if there is a great thing with the pandemic, is that about 20% of the virtual appointments, the video visits, are with new video visit users. And many of these are older folks who have not really experienced that much technology. And so I think one of the permanent changes will be, now that most of our patients have experienced at least one virtual visit, many of them see how easy it is, how convenient it is, and they will continue to make more use of them going forward.
Yeah, that's great. I had my first video checkup during this pandemic time. I completely agree. I see what you're saying.
Mm-hmm.
I'll address this next one, both to Dr. Uppal from the vantage point of a smaller but growing business, and then also to Steve Snelgrove from a relatively larger business, one of our larger employers here in the county. From the vantage point of an employer sponsor of healthcare plans for employees and their families, what changes do you expect will be most prominent as we think about the things that will be permanent within the healthcare environment, or more permanent? Dr. Uppal, do you care to go first?
Yeah, I can go first. So I think what's really going to change is that a radiology waiting room used to be a crowded room, and that changed. You know, with social distancing, we try to keep very few people in the waiting room, and actually we don't even try to keep them waiting in the waiting room. When they are called in for their appointment, they go straight in to have a scan. So no longer are people sitting in the waiting room. That is the biggest change that for radiology imaging centers going forward. And not having family members. It was routine, you know, everybody came for a scan and the entire family came with them. It's like, okay, we're going to go see Dr. Daisy today. Now that's not such a possibility. You're going to come in alone to have your scan, and you're taken straight into the locker room, and you're taken straight to whatever you're having, a CT, an MR, an X-ray, and you are not going to be waiting around for results. You're asked to leave, immediately. So that is going to be a permanent change in imaging. We have gone back to, we have gone back to our pre-pandemic volumes, but obviously, as Mr. Snelgrove mentioned, that there is concern for a second wave. So we are all preparing. And I think none of us want to see delay in care for patients. And I think that was very significant. Some of the changes that the insurance companies made were the pre-authorization, which has always been a huge block. So during the COVID CTs, the pre-authorization went away, but that was only for a short term, not long term. That was only for, but as we know, the virus has not gone away. The infections have not gone away. So people are still getting sick. So that pre-authorization continues to remain a hurdle. So here, for our own employees, we offer Blue Cross Blue Shield plan only, so it's less of a hurdle, but there are still insurance companies out there that are a huge hurdle for care.
Thank you. Steve Snelgrove,
Oh, I have one more point to add.
Please go ahead.
Since we're making a brand new imaging center, and we had started to build it right before the pandemic, when the pandemic hit, I can tell you that a very significant cost in redesign of the whole center was done during the time by me, and we instituted UV lights right into our ceiling. And a lot of the money has gone into it, where we have instituted UV lights, where the UV lights will come on at night after the patients leave to disinfect constantly.
Huh, interesting. Yeah,
Yes.
a lot of foresight related to that.
Yes, and
That
a lot
sounds-
of additional cost, yes, but yes,
Yeah.
so we instituted that.
Excellent.
And the new
Thank you.
center, which is ready now.
Great, great. Hey, Steve, what I think about is, so much in the way of employee benefits, not just health insurance, but work from home policies, people who have, children that are in school during the day and need some flexibility. Are there some permanent changes from the vantage point of a large employer at Howard County Hospital that you envision?
Certainly, I think there's going to be change. There needs to be change. I think in many ways the healthcare system is still fractured, and particularly to the patient, as we are all working under different sets of regulations. I think some of the most significant permanent changes that can evolve, unfortunately today, are still impacted by regulations at the federal level and within the insurance industry, and even at the state level. And I'll give you an example of a couple of those areas. Obviously, telemedicine is available today. Kaiser does it for an insured population, but insurance companies don't always cover the cost of telemedicine. They have to now because of federal government stating that they will. But we know as the numbers of COVID patients went down, we were beginning to get rumblings from insurance companies that they were going to no longer pay for telemedicine, even though the public likes it, and even though our physicians are learning to manage patients effectively that way. So that's something that really needs to become a permanent fix, but it needs to be, I guess, regulated, because the insurance companies will have different parameters about how care should be provided from one product to the next. Other changes are, we have very little excess plant or bed capacity in the state. And that's because we're a rate-regulated system, and you have to get approval from the state to build more beds. So during COVID, when we needed to try and not cancel all of elective surgery and serve the COVID population, we did not have the physical capacity to do that. So I think looking forward in terms of a permanent change in this state anyway, we're going to have to figure out where to create excess bed capacity, ICU capacity, vent machine capacity to serve a future pandemic. That's critically important going on. From operational perspective, I think we're learning that work can be done from home. Zoom and other technologies have proven to be an effective way to get work done. It does still, I think, impact culture when you can't have face-to-face meetings. But if push comes to shove, we can learn to live with this, and there may be some advantages for our employees to work in a different kind of environment in trying to manage their work-life balance. So those are some of the more important and significant things I think can come down the road, in addition to new ways of managing care. I think the concept of a hospital at home, where complex and chronic patients can be managed more effectively and less costly outside of an acute hospital setting, makes sense. And then I think there's got to be convergence with electronic medical records. You know, if you went to an urgent care center and got a COVID test, they may not communicate with your primary care physician that you actually had COVID immediately. So the primary care physician knew that you now had COVID and need to be managed or sent to the hospital. We know there have been deaths across the country because of the lack of information sharing. And I think you need to consider electronic medical record with its HIPAA requirements for privacy almost as a utility, so that all people can have the data when they need it, and the patient is the one who ought to own their data and provide it to their healthcare providers so that we can make informed decisions in a timely manner.
Yeah, that's a great point. It actually leads into the next questions I had, so I'll go there now. I was just asking about, you know, permanent changes from the vantage point of healthcare related technology. So Dr. Uppal, you commented on UV lighting capabilities being installed as one type of technology. Steve, you commented on hospital at home, which is, you know, substantially technology dependent. I'll offer this question to any of our three panelists. What do you see in the way of healthcare related technology that will be likely permanent, that will be likely among the most crucial and highest utility, in addition to EHR, EMR that Steve just commented on?
Yeah, I'd be happy to take a shot at that from a hospital perspective. I think the most significant thing that I think is going on related to technology is wearable devices and what can be communicated through smartphones. It's a game changer, and you know, particularly for patients who are chronic and at risk on almost a daily basis, our ability to monitor their weight, their fluids, their lab results, their heart rates, all of these things are critically important to intervening in a very timely manner. And if we can get those signals real time, I think we can make a huge difference in how we manage these frail, chronically complex patients.
Great, thank you. Dr. Deza, Dr. Uppal, anything to add there?
I would sort of second that because initially, you know, your patient, if they had high blood pressure, you know, had to come to the office to get their blood pressure checked. Now, because people either can't or don't feel comfortable yet, we are now saying, you know, I'll take your blood pressure reading from your home monitor and enter it in myself, and that counts. So whatever technology people can have at home to monitor their blood pressure, their pulse oxes, we've been sending everybody with a COVID positive result gets sent a pulse ox so that they can monitor that at home too. So all of those technologies do help us better manage patients while they're at home.
Great. Thank you. Dr. Uppal, did you have something to add there?
So yeah, I mean, you know, radiology has always been very technology heavy, but I think this is going to change it even further, because the patient may have a scan at imaging center 1, but may end up at hospital number 2, and then may end up at hospital number 3. So for example, they could have a scan at advanced radiology, but they could go and be, you know, admitted at Howard County General. From there, they could be transported to downtown Johns Hopkins if they got worse. So all these different systems need to communicate. If the patient had a scan somewhere else, all the radiologist at Johns Hopkins downtown needs to have access to those images so that these patients can be treated, so the patients are not scanned again. So this is the information across the board, access to all hospitals, to all imaging centers. That is what is going to change in the next year or two. I think CRISP is coming. CRISP is going to take a big role where all the information for all the patients is going to be in CRISP, and it can be accessible to all providers. So because when the first EMR came in, everybody got their own EMR. So there was no unified EMR, but really a unified EMR really needs to happen for these patients. And the younger patients we see, they're very technologically savvy. They don't want to talk to you, so they want to use their Apple phone and they want to make appointment on the Apple. And so trust me, I work with my PAC system, which is called for all our, for making appointment and for imaging turnaround. But my parents who are 80 years old, they don't even own a computer. Yeah. And they don't want to own a computer. So I see it from both sides. My son, who doesn't want to talk to me on his Apple, and he maybe will text me occasionally, and my parents who are not very technologically savvy. So, but they all need to be taken care of.
Yeah, agree. I'll tell you, for me, the fact that I can exchange text with my physician office to do basic stuff like schedule an appointment or confirm an appointment is awesome. So that's great. Okay,
David, you might want to explain that a CRISP is a health information exchange that works within this particular state. And it's not a utility like an electronic medical record yet. I'm not even sure it has the potential to be that, but it is a way for physicians to share information with one another and hospitals as well.
The central repository.
Thank you for explaining that much better than I did, Steve.
Yeah.
And I can add to that it is super helpful for when patients come to the emergency room because the fax system, it sometimes could take 2 or 3 days to get ER records faxed over, but with the CRISP system, you can see it pretty quickly. The only drawback, I agree, Dr. Uppal, is that outpatient CAT scans and things that are ordered by primary care doctor, they don't appear in CRISP, so we only get
Guess what? Charter was the first imaging center invited into CRISP, and all our images are now going to be in CRISP, so which is why I brought it up. I was the first one to go in there because I really want to champion this cause because we all need to share images and data for these patients so that these patients are taken care of. And especially for radiologists, we really need to compare their prior images. And so it is very important for us to have access to someone's prior images. I can tell you that images are performed at Howard County General, and then the patients come to me for their next scan. But now since I am a member of the Howard County General community and I can have access to Epic, I can compare their images, and that is so important.
Because it is a big burden to ask patients to, go to medical records and get the thing on CT. Yeah. So this is great.
Patients. Yeah. And CRISP will be amazing because we will be able to share the data across imaging centers in Maryland. So it's not there yet. Like I said, these changes are really going to happen. And I think maybe the pandemic will really force us to make these changes.
Great, thank you. Yeah, the next question, it's interesting you comment on that. Next question I prepared was about the concept of COVID-19 and the pandemic really having exposed some of the cracks in our armor. As an integrated health maintenance coordinated delivery system within the U.S., both on the global level and on the domestic level. And so my question was, in what most meaningful ways do you anticipate the COVID-19 stress test, if you will result in achieving smarter, more effective healthcare capabilities over the next 3 to 5 years? And it sounds like there's consensus that the electronic health record, electronic medical record, utilization of repositories like a CRISP, et cetera, is key. Is there one? Because I want to get to some of the other questions also. But is there one other in particular that stands out to any of the three panelists? That
I think we need to make sure we have more stockpiles of PPE.
Okay,
yeah.
Great. Okay.
Just PPE, but beds as well and other supplies.
Okay, great. I'll pause here for a second. Leonardo, Alex, Taylor from the Chamber, are there any questions that we've received that we want to address from our audience before I move on to the next one?
I have not seen any questions come through the chat line, and so I think we can move on. But again, for those of you that are watching, certainly want to encourage you to take advantage of the group that we have assembled here. And if you have any questions, please add them to the chat line.
Great, thank you. I'll
I
keep
have
moving
one
forward.
more point to add to that last. Can you hear me?
Yes, I can, please do.
So when the images first came out of China, so radiology, we have a radiologist blog, actually a female radiologist blog. So I don't want to give the name out.
I'll be dialing into that daily, Dr. Uppal, just for interesting reading.
You know, usually I was not a very active member of that group at all, but the images that came out of China, the radiologists shared that very quickly because the Chinese radiologists shared it with the Cornell folks. And so we all became very aware, and we started, you know, we got educated in 5 minutes what a COVID CT looks like. And we know that the COVID CT is very diagnostic for whether you're positive or negative. So that was very, very, very informative. But the interesting part was that since I had less films to read, I was very active on all these Facebook blogs. And I got a lot of actually friends and family from other parts of the world really tapped into it. And they send me images on WhatsApp. I had never used WhatsApp before. This was my first time. And a lot of the physicians from India, I got from a lot of countries. I even lost count. They would send me the images on WhatsApp and say, is this a COVID positive case? So, and that was very interesting for me that somebody was sending me images on WhatsApp. Like, you know, usually I have these high resolution monitors and
you have your little phone.
I was looking at phone on my Apple iPhone and reading people's CTs and giving them information that, yes, this is a positive for COVID-19. So very interesting.
Great. Okay, great. Thanks, Dr. Uppal. Okay, and Greg, I see your question here. I'll try and incorporate that into this next one. So, so among our participants in today's session, there are some very capable and innovative product and service suppliers, providers, investors even, which support the healthcare industry. And this is to any of the panelists who have an idea, who have a thought to offer here. What are some of the most critical new and or expanded needs for products and or services that have been revealed by this COVID-19 situation? And where does the most critical need for private investment in capabilities in the near-term future exist?
Where would you like to start?
Well, Steve, I'm normally the first one to open my mouth, and I end up being the one called on to volunteer. So I'll ask you to comment.
That's me, I guess.
On that one. Yeah, thank you.
Yeah, I think probably in a number of different areas. I think, you know, a better understanding of the health of our communities and our ability to know who is most vulnerable is really important. So again, data, hotspotting where opportunities are. So if you can create the predictive modeling of where disease is going to occur in our community and guide us to a street or a house, so that we begin to partner with these patients or future patients before it gets catastrophic, that would be wonderful. Predictive modeling in healthcare is really what precision medicine is all about, and it's been really elusive, although there are many people working on it. I also think that locally produced PPE that is light and waterproof. You know, we've run at times, we're all running out of supplies or substituting supplies. Some supplies are better than others. I know in the hospital, Ford Motor Company has made gowns for us that is made out of the same material that you use for your airbags. Why is that? It's because it's strong. And it's also very difficult to penetrate in, but it is hot as heck. And so our providers are really struggling with this. So if we could, you know, and there's not the light gowns, the waterproof gowns are in low supply around the world. So if we could have locally produced PPE that people can afford to make and sell at a competitive price in comparison to China, that would be great. And maybe that needs some support from the government. Another thing that I think personally, I think would be very helpful is what I would call low cost PAPRs. Most people probably don't know what a PAPR is, but for those of you who are old enough, let me remind you of how your mother probably dried her hair with those kind of bags you put over your head, but and air was blown in. But this not only covers your head, it covers your whole head, not just your hair. And they are very expensive, but they're very effective at keeping anything from entering your breathing space, because it actually creates positive pressure and pushes things away from you. We know they're very expensive, but we also know that they're basically the best safe way for our employees to take care of patients. So if there's any innovators out there to work on these areas, we already talked about EMRs, wearable monitoring devices is critically important. And then if you're in the education side of the world, continue to invest in helping our community be personally knowledgeable about their own health and understand what to do to stay away from disease, but also create the skilled labor pool that can come into a healthcare setting or into your home to take care of you effectively.
Great,
Broad
thank
range
you.
of things, really.
Yeah, we have a related question that came through the chat, so I'll ask it here. And it's from Greg Miller regarding digital health, like wearable sensors, remote health, apps, tools, artificial intelligence. Will the technological wave accentuate health disparities in our community, or solve for them mostly, right? We talked about the idea of CRISP has been a concept for a long time here in Maryland. I know that. It's tough to get to a standard, and the balance, I think, is Greg's asking about new innovation and trying to avoid disparate solutions that prevent from getting to an effective standard. So if you would comment on that, that would be helpful.
Well, I think it already has created disparities, and I think it has the unfortunate risk of continuing unless there is regulatory help. We know that people who don't have computers, don't have a primary care physician that they can access, don't have transportation to get to healthcare providers, put themselves at much greater risk than those who can afford to do these things. So technology is just another tool in line that creates, helps identify the disparities that we need to overcome.
Great, thank you, Steve. Dr. Deza, Dr. Uppal, comments here?
I mean, I agree, because people have a lot of faith in their doctors. That's how we all grew up, right? You go to someone because you trust them. I still drive an hour to see my primary care physician because, you know, that's the person I've trusted for the last 20 some odd years. And it's very difficult. And I think as technology is moving at a crazy pace, okay? Even in imaging, just in imaging, everything, we know that a lot of it is diagnosed by imaging. And even imaging is changing so rapidly. And if the primary care physicians or the specialists don't keep up with it, you can become outdated very fast and practice medicine, almost outdated, as we would say. So it's definitely a challenge. Not just going to CME courses and stuff, but to constantly educate the physician community. And even during this pandemic, one point that was really amazing was that how everybody became so knowledgeable, not only about their own health, but about this virus. You know, from a 10-year-old to a 80-year-old, everybody understood the virus, how it spreads, and they became like almost immediate experts, right? Everybody became an expert on this disease. So I think the same thing needs to happen for all other disease processes like prostate cancer, breast cancer, lung cancer. Like I can tell you that the cases that I saw during the pandemic, the lung cancer was like the worst case of lung cancer because that patient did not go to see a doctor because they were just so scared to go see a doctor. And I saw stage 4 disease in stage 4 breast cancer, stage 4 lung cancer is because patients waited so long. So we can't let that happen again. We can't forget that you're still going to die of heart disease first more than anything else. So it's very important that we keep that focus.
Great. Thank you. So we have now, I want to get us wrapped up, just to be respectful of everyone's time, in about 6 minutes. So we'll manage time appropriately, and I'll ask our panelists if you could help with that. That would be great. So I think it was Dr. Uppal who made a comment earlier about somewhat of a silver lining, right? So we have a tendency to think about, our mind goes to all the things that we can't do right now, or those that we can't see or interact with directly. In our group discussions, in our breakout session, we talked about some silver linings that some of us have experienced. And so I'll offer this as an open question to either of the panelists, any of the panelists. What are some of the other key silver linings that you see resulting from the crisis and the fact that our healthcare system has had to learn how to pivot very quickly, very effectively, very innovatively? Are there some other silver linings, and if so, what are they?
Well, I think everybody is appreciative of the extra time with family. So that's a given, having more family dinners, more time to do things that we wouldn't otherwise do, learn new hobbies. The other thing that we can think of as a silver lining is, since I'm working from home most of the time, I'm not filling my gas tank as often. So there's some environmental benefits to working from home.
Yeah, like 3 months per gallon for me, right? Yeah. So are there others? And I'll try and tie this into a question we received from one of our participants, Tracy Stevens. She asked, what type of culture do we see in the healthcare community as relates to staff support over the next 2 to 4 years? Are there some silver linings within that, perhaps?
I'm happy to start with that. I think one of the things that we've seen most directly and sincerely is the resiliency of our team to respond to a crisis. In spite of their work-life balances, children issues, elderly parent issues, again, they show up to work every day ready to go, asking questions to make sure they have the knowledge to get through the day. We've also seen phenomenal community support to come together and address this crisis as a community. The county executive, the health department, hospitals, physicians, insurers, all working to leverage ourselves to be the best that we can be and effectively deliver healthcare to not only the COVID patients, but to non-COVID patients as well. And the community, to us at the hospital here, has been very generous with their financial support as well. They've provided dollars for food for our employees, and that kind of support has been so heartwarming. They even did a parade for us as our people came out to the windows in the street to see the welcoming support to our healthcare heroes. So there are some silver linings out of this. It's not something that we want to go through again, but we are prepared. And I think we're going to have to continue to work on resiliency. You know, this is tough, emotionally, physically, mentally, spiritually. All of these things are impacting our healthcare providers in ways that we could never have imagined. And so that community support is really going to need to continue. And we've invested in a lot of programs here to give our providers some respite, both physical and mental respite. To gather themselves and enable them to focus on what is critically important for our patients and as well as themselves.
Great, thank you, Steve. Dr. Deza, any silver linings from your vantage point?
Well, I think I already mentioned mine.
Okay, you got yours,
Yes.
Dr. Uppal?
Yeah, so I mean, initially, you know, it was very stressful, but the amazing thing was that the teamwork that my staff, just the way they all came together and overcame, you know, somebody had young kids and they were all out of school. We were able to work out, you know, their family issues, and everybody showed up to work every single day. I have never had so much support, you know, till now in the last 6 years. And that the part that we survived this pandemic really bonds the whole team so much stronger. I cannot say that enough. We got an overwhelming response from the community. People came. I didn't even know that people, you know, these people existed. The Vietnamese community stayed up all night to make masks for us. I mean, I could tell you the hundreds of stories that people did. They went above and beyond. I, and you know, like at that point, we were pretty stressed because we were taking care of sick patients. We didn't know what this virus was about. And to see this overwhelming support from a community, it's very, very heartening because you're like, wow, I'm not the only one going through this. You know, these people are with us.
Right.
So I think those were all positives. And for me, there was an additional positive. My kids always said that I cared more about charter than them. So, and I worked a lot. So during this time, actually, I was amazed to see my boys really come through, and be proud of what I do. And, you know, they were just very supportive and there for me. So for a personal standpoint and professional, it was a very difficult time. I will never forget it. Um, it's something that, but I think it made us all a lot stronger and maybe ready, heaven forbid, if this ever happens again.
Great. Thank you for that. And thank you for your thoughts there. I mean, with those comments, I'll kind of move us to a close. And before I turn it over to Leonardo, yeah, it's interesting. Yeah, the comments just on that last part about silver linings from Steve, Dr. Deza, Dr. Uppal. You know, our technology is amazing, but it strikes me that each of the three of you consistently talked about the people facet of it, the community strong facets of what's helped us get through this time, and that's really, really important. Well, I'll close by saying I've really thoroughly enjoyed the discussion and the insights that we've shared. Discussion for me has reinforced that there's strength in interacting as a community and getting after and dealing with these issues. And although we're a bit more constrained than usual about getting together in person as much, that there are ways for us to stay connected, for us to share ideas, for us to learn, for us to innovate and be resilient together going forward. So thank you immensely to all of the participants in the call for investing your time to participate today. In particular, special thanks to our three distinguished panelists, Dr. Deza, Dr. Uppal, and Steve Snelgrove. We really do appreciate it, as well as to Leonardo and the Chamber staff and the Chamber for making this possible. So, and thanks for allowing me to moderate and get to know each of you a bit better. So with that, Leonardo, I will turn it back over to you in order to get us wrapped up.
Thank you, David, again for your support and for your involvement today. And again, I echo your comments and thank you to Dr. Deza, Dr. Uppal, and to Steve for sharing your insights. Just a few things that I will touch on, and this will wrap us up. So the first thing I want to just touch bases on, just reminding you of some upcoming events, particularly for those of you that may be government contractors or perhaps you serve them. We've got a great discussion coming up on Thursday, which will be part of our Scale Up series, and that is on government contracting, mergers and acquisitions, and how to create value in an uncertain economy. So that's coming up on the 24th from 12 to 1:30 on Thursday. Also, our Biz Breakfast next week will, as we come into October, that will be the start of a new fiscal year. And so again, this is talking about strategies and ultimately in selling to the federal government. And then our YPN, our young professionals. You know, we've got a great conversation that will be taking place as part of our Accelerate series on October 6th. And so, so you'll hear from basically related to some coping strategies as it relates to continuing this process of working remote, et cetera. And then lastly, I want to just, let's see here. If I could get my, there we go. We're partnering once again with Howard County Executive and the Economic Development Authority on the County Executive Small Business Series. That's going to start on the 7th, go on the 14th and 21st, recognizing that we have various challenges at home. It'll be from 9:30 to 12 for 3 consecutive, I think those are Wednesdays. Again, some phenomenal topics that we'll be touching bases on. So again, check the Chamber website out for additional details there. And so with that, again, thank you all for coming out. Have a great rest of your day, and I will see you soon.
Thank you for inviting me. Bye-bye.
You're welcome.